Kuzangpula, before I start, I would like to thank Weather Events for inviting me to talk on mental health today. This show is a very important medium through which we can raise awareness on mental health in the country, and I applaud We Discover for the determination. My name is Tensin Choden and I have my background in Masters in Science and Counseling with a postgraduate diploma in Cognitive Analytic Therapy alongside being an international certified addiction counselor. I have been working at RTC for almost 3 years now, and the experience I have had at RTC has been enriching, inspiring and life-changing, and I can confidently say that the support received towards the counseling division at RTC by the academic department, the student services division, or any other departments directly or indirectly through other services provided by the institution for the support of our students have been exceptionally wonderful. Today I would be speaking about mental health and RTC's response towards supporting mental health through activities before the pandemics, during normal school days and even throughout the pandemic. Mental health is very significant at every stage of life. Mental health encompasses our emotional, psychological and social well-being. It affects how we think, we feel and we act. It also plays a vital role to determine how we handle stress, relate to others and make choices. Many factors contribute to mental health problems, such as biological factors like genes or brain chemistry, life experiences such as trauma and abuse amongst many others, and family history of mental health problems. Most people believe that mental health conditions are rare and happen to someone else. In fact, mental health conditions are more common and widespread than we think. There are various signs to be aware of mental health concerns, like prolonged sadness, excessive fears, worries and anxieties, dramatic changes in eating or sleeping habits, suicidal thoughts, substance use, amongst various others. If you think you or someone you know may have a mental health concern and your emotional health is starting to get wedged, it is very crucial to reach out and seek help in order for an individual to cope well. Mental health is just like physical health. For instance, if you feel like you're down with flu, you visit the doctor for medicines to get healthier. Or if you feel you're gaining weight, you enroll in a gym to tone up. Similarly, mental health concerns are the same. When you feel uneasy, it is very important to reach out and to talk to a professional. Emotional and mental health is very vital as it is a fundamental fragment of life. Being healthy emotionally can stimulate productivity and effectiveness in our daily lives and plays a very important role in the health of your relationships and allows you to cope with adversity and adapt to changes in your life with resilience. The COVID-19 pandemic may be stressful for a lot of people. Fear and anxiety about a new disease and what can happen next could be overwhelming and source of strong emotions for adults and children. With the sudden alteration in the way of living alongside loss of jobs, spending more time indoors and social distancing, it can make people feel isolated, lonely, and can increase stress and anxiety. Therefore, paying attention to your mental health is so very important. Recognizing warning signs, keeping in touch with your family and your friends, and engaging in activities that enhance your dopamine or serotonin levels, also known as happiness hormones, are dynamic in taking care of your emotional health, and it should be of significance. We at RTC have prioritized our students' well-being and emotional health as we strongly believe that it plays a vital role to support the psychological well-being of our students and also an essential part for the academic success and retention. A survey conducted by the American College Health Association found that mental health needs are strongly related to measures of academic success. We have been trying to put this into practice by rigorously engaging in promoting student mental health and catering to individual needs and concerns. We've been keenly involved in integrating comprehensive services and support to our students, starting from first year, sophomore and final year students, through development and implementation of programs on a broad range of mental health awareness topics such as stress, anxiety, depression, sleep, substance use, amongst others. Also to add on study skills and assertiveness training in the classrooms and the student resident halls. We also have an anxiety group that meet on a bi-weekly basis. Students usually come together and discuss their shared experiences. Structure of the groups that are established depends upon the precise needs of our students. We have trained our student leaders on campus and resident assistants that work in student hostels through sessions to support them to discern mental health warning signs in students and work as a mental health gatekeeper for student referrals to be made to the college counselors. They have been doing a great job. We have had workshops for the faculty and staffs of RTC on psychological first aid and training on working as a mental health gatekeeper while dealing with students, and the outcome has been very impressive. Our faculties have been doing a wonderful job in helping to identify the needs and concerns of our students, working with them, and in helping to make referrals for students to the counselors. The counseling division has also formed the Royal Thimphu Wellness Club, also known as RTC Wellness Club, where we enhance awareness on campus through posters put up on bulletin boards, meet on a monthly basis to discuss plans to promote mental health, and observe mental health awareness days on campus. To illustrate an example, last year we observed the World Suicide Prevention Day by wearing the color yellow. Psychoeducational talks in the classrooms and poster presentations on campus were widespread. We achieved a very good response from our students. Furthermore, we have also focused on building collaborative relationships between the school tutors, the counselors and students in order to ensure a student's well-being and academic success. These are a few of the many things that our counseling unit at RTC has been continuously working on in order to highlight and look after the needs of our students. We at RTC have been taking initiatives to ensure that all our students feel well cared for, since there can be a roller coaster of emotions owing to the change of routine due to the pandemic. Presently, we have conducted mental health sessions for international students on campus, covering a wide range of arenas such as dealing with culture shock, dealing with remote learning, and change in their study abroad goal due to COVID-19, both physically and mentally. Discussing social setting on campus and adjustments, covering both challenges and opportunities. Also, most importantly, specific cases of students with a record of mental health from the past, discussion on the needs and how RTC can help. For our Bhutanese students studying abroad, the goal was to give them support due to COVID-19. All 18 students have had at least one virtual counseling session, while some have had few more sessions which are still ongoing. Most of the sessions were based on how they were dealing with the change, the stress of pandemic, and how students can take care of their mental and physical health during this difficult time. We have also started a counselor corner where we send our mental health newsletters to our entire student body with tips and activities to promote mental health and to remind our students to practice self-compassion during these tiring times. We also have counseling access for faculties and staffs, as we believe that self-care and taking care of one's mental health is so important, be it any individual. One-on-one counseling sessions have also been provided for students downtown. We have also made it a point to reach out to the entire student body through regular check-ins over emails and telephonic conversations. Overall, there has been a continuum of care for our students, especially those lagging behind academically. In partnership with the faculties, and following up with our students through telecounseling, ensuring that we place our students' well-being in high regard. To conclude with, I would like to say, only if we are emotionally well can we be happier, perform well, and engage efficiently. And this is why we have placed high importance to nurturing our students' overall development, welfare, while focusing on their academics as well. Thank you for having me here today, Lau.